dropping.
Good afternoon, everyone. Thanks for joining us this Wednesday before Thanksgiving. We wanted to jump in and get to some of the data. We don't have a lot of, in quotes, news to report, so we'd like to get to as many questions as we can. If you have a question, write it in the comment section below the live stream, and be happy to try to get to as many as we can this afternoon. Let's start with the county's dashboard. If you visit dutchessny.gov, you can see update on the individual case data. So to date, we've conducted 273,668 COVID-related tests across the county. Remember, if you feel that you've come into contact with an individual who may have contracted the disease or are experiencing some symptoms, remember, first contact your physician. And in most cases, a prescription is necessary for a test, but getting tested is a smart idea. At least will give you a peace of mind at that moment. But 273,668 conducted tests. We are currently monitoring 718 active cases. 718 active cases. Now that has been on a steady climb for 3 weeks now. I think only 2 weeks ago, the county was monitoring 343 active cases. So 2 weeks ago, we were monitoring 343 active cases, over 100% increase. Since then, we're now at 718. At the same time, 2 weeks ago, we saw 19 individuals hospitalized. Today, we are now at 42 individuals hospitalized in the county. Now at our peak, we had 108 individuals in county hospitals, which was a stress on the hospital system. We never got so high that there was that we needed alternative facilities, but certainly that number was a point of stress for the hospital system. Of course, anyone in the hospital because of the virus is certainly a concern. We now have 185 individuals who have succumbed to the disease since February of this year, and sadly, we are seeing among hospitalizations there are cases that are severe. So again, we want to really encourage people to take the steps necessary to protect your own health and the health of others. The positivity rate. Remember, this is the number of positive tests divided by the number of tests given. In any given moment, the region, the Mid-Hudson region, has a positivity rate of 3.9%, with Dutchess and our 7-day rolling average at 3.2%. 3.2%. Just as a reference, in the last 96 hours, the last 4 days, we've conducted 9,768 tests. Let's do that again. In the last 4 days, we've conducted 9,768 tests, 318 of them positive, and that gets you very close to that 3.2% 7-day rolling average. We are concerned, as you ought to be, about the rate of growth in cases. We are seeing the transmission of the disease coming from smaller social gatherings and hanging out, which we understand, right? We get it. It's sort of, one, it's human nature to socialize. Two, we've been at this for 11 months. People are either upset about having to follow the precautions, don't want to follow the precautions, or just tired of following those precautions. That we understand, but we are seeing the positive cases, and in some cases these become severe. Individuals become hospitalized, and as I said, we have seen a good number, sadly, of deaths these last 2 weeks. We're seeing the transmission mostly come from community and small gatherings, mostly interactions between, in essence, people who know each other, which is logical and understandable, but it's also a reminder that we need to be considerate of our health and the health of the people that we interact with. We are seeing certainly some cases come from travel or travel-related activities. That's important to know. And there are steps, again, that we can each take individually to be safe. So we remind you, as we have many times before, take those basic precautions like monitoring your own health. If you do not feel well, this is not a time to travel or to interact with individuals. Instead, it is the time to stay somewhat isolated, monitor your own health, and if you feel that you've contracted the virus, again, contact your physician. They'll walk you through what steps are appropriate and likely encourage you to get a test as we would. So again, start with knowing your own health. If you're not feeling well and you feel like you may have some of the symptoms, don't socialize, don't go into those gatherings, and certainly protect your own health. Wash your hands, take the personal hygiene precautions that we've talked about these last months. Remember, engage in that physical distancing and just be sensitive to both, again, your sensitivity and the sensitivity of others. Kind of keep your distance and wear a mask. Do these things and we can slow the spread of the disease. So it really is for us a matter of just making those choices to be considerate of our health and the health of others. But I do want to say this, after the last 10 months, we are at a point that we expected could come. The question is, how severe will these next several weeks be? And it really is a question that only you and I can answer individually by making those and making those choices and making those decisions that would limit the transmission of the disease. We are at a point now where the rate of growth of cases and the severity of those cases is concerning. And we are at a moment where it really must be all hands on deck, and that as residents, we just summon deep and again, follow those basic precautions and do your best to be safe and to be considerate of your health and the health of others. And that is the message that we will reiterate. I will reiterate today as often as I can. Mackenzie is asking, what percentage puts Dutchess County into the yellow or orange zones? I was talking to someone yesterday, and I said, we're all using this new language that just came about these last few weeks. And so, Mackenzie, thanks for asking what is this new framework that we keep talking about. And to their credit, I do give credit to the state in identifying this sort of as a way of monitoring activity and slowing transmission if we see some areas of growth. Now, first of all, it is not likely that we see the entire county enter a zone, but it is possible. The way the state has identified this is very simply either through zip code or census block. So the concept here is to narrow a geographic area to as small as is appropriate and then measure that. And so yellow is the 7-day rolling average of positivity. It must be above 3% for 10 days, and 12 or more new daily cases per 100,000 on a 7-day rolling average. That and is very, very important. Yes, there will be areas already that have exceeded 3%. If we're at our positivity rate's 3.2. 3.2 is our positivity rate. Clearly, in order to be at 3.2, there have to be areas that are above 3 and areas that are basically below 3. That said, those zip codes that exceed 3% must also see greater than 12 or more daily cases per 100,000 on a 7-day average. Now, we can get the zip code data if we get that through state data. But the 7-day case average, if you will, is detail that the state has access to. But we continue to monitor this. So yellow is above 3% and 12 or more daily cases per 100,000 people. Orange is above 4% and 12 or more per 100,000 people. And then the red is 5% or more and 12 more daily cases per 100,000. So you need both of those things. And then within those categories are certain restrictions. Yellow starts a restriction in gatherings, social gatherings, and other indoor activities. It also reduces the capacity at houses of, it holds what currently is the house of worship limitation. And businesses can remain open. Schools have to test. In order to keep schools open in a yellow zone, we would have to conduct regular tests to make sure there's a transmission rate below the state threshold. That said, I will say out loud, we are not seeing, and there are very few places that can point to a concern regarding transmission within schools. Yes, there are people who are contracting the disease outside of school, and some are coming into school into contact with others, but because of the safety steps that schools have taken, in school, we are seeing a much lower transmission rate, in fact, a fraction of what we see in the general population, which is both comforting, right? School districts are taking those steps. Our kids are not vectors for the disease necessarily. They can be vectors for the disease, but we're not seeing that interaction, and therefore the positivity rates are so much lower. So in a structured environment like a school, kids are not seeing the transmission. Very positive. If you get to orange and red, then there are other restrictions beyond what yellow is that further shrinks capacity of events, etc. So the hope here is that we'll just make choices that don't move the numbers up that high, but at this rate, we are obviously, as the state as a whole is seeing increases, and we are seeing a rate of increase that is very concerning to us, and it ought to be to you. So these are some of the things we want to pay attention to. Okay, Kelly, do daycares, nursery schools have to close, disinfect if a student's parent positive for COVID, like school districts? Okay, there's a different set of expectations in every case. It really does depend on who tests positive and whether they've had interaction within a facility or not. In every case, our health department would be made aware, and we do provide some guidance. If there's a public health risk, meaning that there's a concern that there's a broader impact than maybe, say, one student and one individual, there may be a require for closure, disinfecting, and reopening. But again, it really is on a case-by-case basis, because you have to have that social interaction in order basically to contract and transmit the disease. Yes, there are other ways for it to happen, but we know that those prolonged interactions are when, without precautions, or when people get sick, like any other infectious disease that's transmitted through water droplets like this one. So again, not in every case, but in most cases you'll find that they would close for a period of time, disinfect and reopen. That may be just overnight and reopen, that might be a 24-hour period, but it is based on every individual case. In some cases, we've had businesses where an employee or an individual might test positive, but they've had no interaction with customers or what have you, no public notice, there's no need to go through any stringent restrictions. And then there are cases, and we've had a few recently, where individuals have had multiple contacts. We don't feel we've gotten a full detail, if you will, of all those contacts, and therefore the business might close, be cleaned, disinfected, and some time taken to make sure that those who came into contact with a positive case also have been contacted. So those are the basic precautions, but not in every case. So just be aware of that. And if you have questions regarding a situation, you can visit dutchessny.gov. You can contact our hotline. There are ways to get basic information if you have a particular concern or question regarding a facility you may make use of. Hudson Valley, New York is asking a question. The whole Hudson Valley is asking, what is their support for additional hospital resources or field location? So at the moment, we meet regularly with hospital administration. Great question. If I remember correctly, we have somewhere in the neighborhood of 400 to 450 available total beds in our local hospital system in a situation like this. As I said, as we got into that 108 number earlier this year, there was cause for concern. We activated the use of to your term, a field station, an alternate care facility through our Medical Reserve Corps at Dutchess Community College. That option still exists to us and would be activated if we felt the rate of hospitalizations were growing beyond what the hospitals could manage. I will tell you that our hospital administration of both New Vance, which administers 2 hospitals in Dutchess County, Northern Dutchess and Vassar, and the Westchester Medical Network administers the Mid-Hudson Regional Hospital. They have taken sort of safety steps now. They're preparing certainly for the potential in increased cases. But they also have said, to use their term, they know the playbook a lot better. We know more about how the disease acts. We don't necessarily have all the therapies to address that, certainly, although Regeneron, I think, was just recently approved for some of its treatment. It's one treatment. And of course, we're waiting on vaccinations and vaccines. But that said, they know the playbook a little bit better. They feel very confident where they are today. We'll continue to monitor with them not only the total cases, but the severity of those cases and the rate of increase in those cases. As of today, We don't need to activate alternate care options, but we do have that within our capacity when and if necessary. Remember a couple things. Folks might say, well, 100 beds is only 25% of the 400 total. Why is that a concern? Remember, there are only so many beds that are able to be isolated in the way that individuals can be safe. So when they exceed those beds, they have to close a wing and expand into rooms that are not necessarily built for that kind of isolation, create in essence a whole wing. So sometimes it doesn't necessarily mean that because you have a certain number of COVID cases that you have access to every bed. And that becomes the balancing act that the hospitals have to pay attention to. But right now, they don't feel stressed. They are not alarmed, but they have taken precautionary steps in connection and coordination with us to be prepared for what could happen next. Teresa, please explain the correct way to wear a mask. Is today the correct day to wear a mask day? This is we've had a lot of questions about this. Now, I'm not going to pretend to be an expert. This is what I do know. First of all, if you're using a true medical mask, the N95, those are to be fitted, right? They're supposed to be fitted to your face, and they're supposed to enclose and cover your face, your nose, etc. So they should be fitted and placed in a secure way. Now, not everybody has an N95, and Dr. Wiley, our commissioner, will say to you, unless you're fitting the N95, and I agree with him, unless you're fitting it, it really isn't going to be helpful to you out on the street. So a traditional medical mask should cover your face and mouth. It should cover your face and mouth. And in most cases, those medical masks have a piece of aluminum towards the top. You can cinch that around your nose, and of course, you want to make sure that the ties are tight enough that it does encompass and close and cover your face. Now, a traditional cloth mask, Dr. Wythian will also say that the double and triple ply cloth mask is the most appropriate of a cloth mask. This one is from the New York Mets, and I only say that because I, as you might know, am a Mets fan, and this is the New York Mets donated these across the state of New York. And here's a shout out to Father Joe, I think from St. Mary's. He's a Mets fan as well. Same deal. You want to cover your face and your mouth and your nose, and you just want to be sensitive to be sure that is covering those areas that you can sneeze or cough out of. But again, with a mask, certainly a cloth mask, you want to make sure it's clean, you want to make sure it's disinfected. If you keep wearing it over and over and over again without cleaning it, it's not providing you the same benefit. So that's a good question and what you ought to be paying attention to. Miriam, will we be entering a yellow zone? I mean, the short answer to the question is we are likely to experience one, but we won't know until we get much closer because, again, you have to monitor over a 7-day average, 12 positive cases or more per 100,000 people, and a rate of positivity above 3%. Those two things. For instance, in a small town like mine, I live in Red Hook. If you take that zip code, it doesn't take that many cases to get to 3% per the number of tests, fewer people. But you have to get that 12 cases per 100,000. You reverse. It might take a longer time to get 3% positivity in the 12601 zip code in Poughkeepsie, but you might get the 12 cases per 100,000. So both of those things are the measurement tool the state uses. Again, it is unlikely that the county as a whole enters into one of these zones. It's more likely that a segment of the community, a zip code or a neighborhood could move into that area. When it does, the state notifies the county's health department. We then coordinate with local municipalities, town, village, city, and the school district to prepare for that. We also are working to be sure that there is the testing capacity. Now, the state needs to make available to us the test machines and the test strips, but we'll continue to work with school districts to be prepared for the testing requirement. William, why do we need a prescription when in New York City it is free? There are a couple things. So I don't know all of New York City's test sites and how they operate. There are test locations that the state administers regionally. Sadly, the closest one to us is Bear Mountain, is the Bear Mountain Park area. You can look those up. But the test is still required in nearly every case. CVS, or a hospital or any one of the urgent cares, you do need a prescription for the test, and that is something that you do have to do. I don't know if New York City just lets you walk up in every case, but there are no such facilities operated by the state of New York within really the 2 or 3 counties here. And if you do have a testing question, you can visit dutchessny.gov/coronavirus testing. Deborah, where has the flu gone? We hear nothing about flu, but there is a huge push for vaccine, highly suspicious. Deborah, not really suspicious at all. Every week we talk about the flu and the flu shots, I watch most of the media. There is quite a bit of conversation about the flu. One of the reasons that obviously it's not consuming all of our time is because we do have the ability to manage the flu a little bit better. But we've said the flu continues to be, the traditional flu continues to be of concern. If you choose to take a flu vaccine, this would be the year to do it. Again, it's your choice. But if that's something you'd like to do or take advantage of, you should. What I can tell you is COVID is a real virus. It's affecting a good number of people, and because we don't have the therapies in place, we don't have treatments in place just yet, it does wreak a greater degree of havoc among a certain population. So that said, we'll continue to encourage you to be smart about the flu and to take precautionary steps in this case as well. Now, you can visit the New York State Flu Tracker, and that information is available this week in Dutchess County. So the 3 days of this week, there were 113 tests and 6 of them positive, 5.3% flu positivity rate. So if you do visit the New York State Flu Tracker, this week in Dutchess County, you'll see that there were 113 flu tests conducted and 6 positives among them these last 3 days. So that information is available. We'll continue to share it with you, and I don't think there's any effort, certainly on our part, to keep that from you. Wendy, rumor going around that restaurants are on the brink of going takeout curbside only. I will tell you that if it is a day that ends in Y, there is a rumor that the governor of New York is going to do something that we won't necessarily all embrace. I only say that half kiddingly. That is certainly rumor and gossip. This is what I know. The state has reinforced with us, meaning county leaders across the state, that they are relying on this micro-cluster framework. So at the moment, the state is not saying that there is any broad or wide-scale effort to apply further restrictions, but rather rely on the yellow, orange, red framework, which again, we can poke fun a little bit, but this is a good structure. It's a good framework for monitoring cases and then taking action in areas where we hopefully can reduce transmission without impacting the entirety of the community. And that's something that the state has said they want to rely on. So no news on that as of yet. Again, I do think though, this is a good time just to remind people to take those steps, those precautionary steps. And by the way, whether it's the flu or otherwise, or flu or COVID-19, taking these kinds of steps help to slow the spread of the disease. So wear the mask, engage in the physical distancing, wash your hands, keep your gatherings small, and do be most sensitive about your own health. If you think it's traditional allergies, take some time to be sure. Check your temperature, make sure that you're feeling okay, maybe contact your physician. Just be sensitive to that, be considerate of your health and the health of others. I do want to remind you that Dr. Wythian, Anil Wythian, is our Commissioner of Health. He's providing on every Monday and Friday video updates. Those Tuesdays, this is Thursdays, what are they? Wednesdays and Fridays.
Monday and Friday.
I got it right, I want this. So every Monday and Friday, but not this Friday because of the holiday. He's providing those updates. Good information. We take some of the questions that you have throughout the week, and Dr. Wythian gets to sort of react to them and try to provide you some basic input and information. And I know that it's his messaging has been very helpful. And Dr. Wythian is an infectious disease doctor and has had a considerable amount of experience, dealing with infectious disease, but has been leading a dedicated group of behavioral and community health employees who've been doing tremendous work these last 10, 11 months. So be sensitive. So that information is available for you, and as I said, he'll give those regular updates. Keep in mind when you if you're tested, one, if you're not feeling well, be tested. If you may have come into contact with an individual who's tested positive, you're likely to receive a phone call from a contact tracer. These are individuals who engage in an effort to identify how the disease could be transmitted. Please answer the phone if you can. Please answer the phone. More than likely, it'll say New York State Contact Tracing, New York State Health Department, Dutchess County. There will be some tag or identification on the call, and they'll ask you a few questions to kind of identify how much at risk you might have been, and then also encourage you likely to test and to take certain steps to be safe. If you come into close contact with someone who's tested positive, you're going to be asked to quarantine for 14 days. That's part of the process of being sure that we don't continue to transmit the disease or continue the spread of the disease. And if you'd like, New York State has a Bluetooth enabled app, COVID Alert New York. So if you download that on your app store, whether it's an iPhone or any of the other handheld devices, you go to your app store, you can download COVID Alert NY. And the good part about this is, yes, it does text you and communicate with you if it feels if you've come into contact with someone who's tested positive. But it's also a way that you can get some of the links necessary to get the paperwork to follow up. So it does give you that direct connection. That information that you provide is not shared publicly and is protected. And again, that's just one tool you can use. So let's talk a little bit about some detail here in Dutchess County. We, as I said, have not seen the designation of any of these microclusters. We're not there, although I suspect that we will experience one if cases continue to rise at the pace they are. As I said, we don't have access to all of the data points that the state uses to do the calculations for these microclusters, but we continue to monitor with the state, and we'll obviously take action if that becomes necessary. We are designated on that scale. If you look at the phases, we're designated as a Tier 2 community, which has certain restrictions, and that's based on population and density. But if you look at the breakdown the state of New York uses, we're considered a Tier 2 county. I consider us a Tier 1 county, but the state of New York, for purposes of this, considers us a Tier 2 county, and there's some restrictions in each of those categories that align with where you fall in that tiering of municipalities. So again, we want you to be vigilant, be considerate of your health and the health of others. Also, if you have a question while we're getting through the town hall, if you have a question, write it in that comment section below the live stream, and we'll happily get to as many as I can this afternoon. So you all know that tomorrow is Thanksgiving, and I'll share some thoughts about that a little bit later, but tomorrow's Thanksgiving. We are encouraging you just to keep your events small. Keep the gatherings small, stay to and interact with individuals who you know and trust, who have taken certain precautions for their own health and your health. This just isn't the year to have a big party. I understand it, believe me, it's been going on for a long time, and we've lost a lot of holidays together. But there are ways to interact and to celebrate without necessarily all being piled in on the couch, arguing with one another, or giving thanks and being happy with one another. There are ways to do that. We'd encourage you to do that. But as we get into Thanksgiving and then following the Black Friday shopping period, just be sensitive and safe, right? Avoid large gatherings. You may want to obviously avoid places where people aren't taking the steps to protect themselves that you are. Be smart. Keep those activities small. Stay with the family that you know are safe and have taken those steps and would be considerate of your health and protecting with you. And if you choose to do some shopping online, I'd encourage you to visit any one of your chambers of commerce first locally. Shop Hudson Valley is one of the tools that the counties in the region are using to direct people to local businesses. This is really, if there ever was a year to provide assistance to small businesses and neighborhood businesses, this is it. So I know that people are struggling financially, and I know not everyone has the same resources that you've had in the past, but if you have the money to do so, please choose to shop local, to take your business to a, okay, I'll get to that too. Please try to take your business to a neighborhood business. If you're still buying food for tomorrow, maybe go to a local farmer's market and get a local product to share with your family. If you're doing your holiday shopping or starting your holiday shopping, avoid those large crowds and do do try to keep your business local. So many businesses have been struggling to keep afloat, and I'm just amazed how many have been able to still keep their doors open under the circumstances. And if we can help a little bit, this is the time to do it. It's also a time to consider if you're giving gifts. Yes, buying something that somebody can open and can be wrapped up in that way is a great way to buy a gift, buy it local. But you can also make a contribution to a charity that might speak to you, or a community organization that might be important to you. And you can do that in memory or in honor or in the name of a friend or family. Those organizations too are struggling this year, not being able to engage in the same kind of fundraising, still feeling the same challenges that so many others are. So, like small businesses as well, a lot of these not-for-profits are really struggling along, and that could be an opportunity for us to show our support and maybe buy a gift that has the ability to pay it forward. So again, just want to encourage you, keep Thanksgiving small. Remember to only socialize if you can with those people who have taken those same safety steps that you'd expect for yourself. And if you're out shopping over the weekend, try to do it in downtown. Try to do it in a neighborhood shop, but do it safely and be smart about that. We just know that the cases are going to continue. We've seen this in other countries that don't have Thanksgiving, but they have similar holidays or holidays that would compound cases. And we know that Thanksgiving followed by Hanukkah, followed by Christmas, followed by New Year, just becomes a compounding effect. And we're obviously concerned about your health and the shared challenges that the community have if the cases continue to rise at the pace they are. Deborah, she is all for helping others, but concerned about bringing people into our county with turkey giveaway events. Should we be concerned? Well, I don't know that we're necessarily bringing people in as much as I know there are organizations that continue to have those kind of giveaways. We have the same basic expectation: be safe. Physically distance, wear the masks, and be safe. We don't, this is a hard enough time for everyone. We don't want to compound problems, and if we can be safe in doing those things, we certainly don't discourage them. We just encourage people to take those precautions. So please, I would say to church groups and houses of worship and community organizations that are participating in this way, very important that they do that. But just be safe about it. Make sure no gatherings of any size. Wear those face masks and physically distance as you participate in those types of activities. I am grateful to Hudson River Housing. Just want to note they are providing at our homeless shelter. Dutchess County in fact, expanded our homeless shelter. As you likely know, some other communities were closing down their shelters. We created one on the campus at the Sheriff's Office. Grateful to Sheriff Anderson and the staff there, along with the behavioral health team. And our partners at Mental Health America, Hudson River Housing, and Dutchess Outreach. They'll be providing a Thanksgiving meal to those that are taking advantage of the homeless shelter there, and we're grateful for them. So just be safe about it. Amber, do you have information where the vaccine clinics will be located and how they'll screen for different phases? How does someone immune compromised prove it? Amber, a lot of good questions that are getting answered as we speak. Excuse me. Vaccines not yet available. We don't expect them to be available, certainly in limited scale until the first part of the new year, in broader scale throughout the first into the second quarter of next year. So we know, I think as of today, there are 3 vaccines that are showing a good promise from in the neighborhood of 90 to 95% efficacy, meaning they seem to be treating the virus at a relatively good rate. The Operation Warp Speed is what the federal government's calling it. It's the development of the vaccine. Now these companies, these pharmaceutical companies, have been engaged in developing the vaccine. It's showing good promise. As part of Operation Warp Speed is this effort to distribute the vaccines. That'll happen in partnership with state and county governments. In New York, the expectation is that county governments will play a role in getting these vaccines to distribution points. Those have not yet been identified, and we'll work on those over the next several weeks. Counties are to have distribution plans. We are working with state and federal leaders on vaccine storage because in all of these cases require certain refrigeration and protection. Some of these vaccines are 2 doses. In fact, I think 2 of the 3 are 2 doses, meaning you get one and then some days later you've got to come back and get that second dose, which is complicated. We don't want to administer the first and not get to the second, and we don't want to have administer the first and not have access to the second. And there is currently one that is only one dose. But at the end of the day, county governments working with the state government, working with the United States military is participating, will be participating in this distribution and access to vaccination. The phasing, if you will, is likely that those who are vulnerable, frontline staff, healthcare, emergency responders would be among the first to access the vaccine. And how you prove that is likely to be done between your physician and the organizations administering those vaccines. But we'll keep you posted. We are working toward that. County executives and county leaders have been meeting basically twice a week on this, and we've been coordinating with state and federal leaders. Had a very good conversation with federal leaders this past week. State leaders will be meeting again with next week. And I just want to say this. I mean, the work that we've been doing at the county level is so critically important in this country, and in particular in New York. The response to a public health crisis begins with county governments. We are the entity in the state of New York that's responsible for being on the ground, and you've seen us doing it. It's not sort of casual. We don't have the town hall meetings just to report about what other people are doing. County governments, county public health staff have been working around the clock since January of this year, focused on first prevention, and then we were in the midst of pandemic response, and we have been ever since. Distributing and giving access to vaccinations, if you choose to take one, is likely going to be the most important work county governments will have ever undertaken. It is complicated, it requires a great deal of coordination, and it is life-saving if the trials prove to be as effective as they seem to be. So at this point, we're working earnestly and deliberately to develop those plans and to work with other county governments and other providers to be sure that we're prepared to assist in the distribution and access to vaccines. So keep an eye out for that, and there'll be more information as it becomes available. Harvey, local infection rate is 3.9%. At what point would it designate a microcluster yellow zone? Let's go back to the first. The regional positivity rate is 3.9%, 3.8% today. What did we just say? Is Harvey got it? Yes, you're right. So that is the regional positivity rate. 3.9% is the rate of positive cases divided by the total number of tests for a 6-county region, correct? Go back to the county by county slide. Dutchess County's positivity rate is 3.2%. That's the 7-day rolling average. It is unlikely that an entire county or an entire community, an entire county would be designated one of those microclusters. Let's bring the yellow, orange, and red up so you can see that. The state is using this microcluster guidance based on 2 standards: a positivity rate and 12 or more daily cases per 100,000 people. Dutchess County is approximately 300,000 people, 36, did I do my math right? 36 positive cases daily on a 7-day rolling average would be that and the positivity rate. So the goal by the state is to isolate those cluster zones to zip codes or the smallest division of municipalities possible. And yes, there are likely areas in Dutchess that have exceeded 3%. They may not currently exceed the 12, and therefore are not yet identified as a cluster. Because some of that data is housed by the state of New York, we don't have access to all the calculations on every given day, but we will be given a direction by the state if they believe a certain area within the county is getting to the point of exceeding one of those microcluster zones. So we're not there yet, but I do think that we ought to be prepared for it, and we are preparing at the county level to assist school districts and municipalities should we have that sort of designation, and we'll continue to work toward that. If you have additional questions, please write them in the comment section below the live feed. We'll get to a couple more before we close up this afternoon. Carla, if you have been quarantined because someone in your household tested positive, but you have not been tested, can you get tested just to know? Well, the short answer is yes, you can be tested. But you still have to go through the same process, right? You still need to contact your physician if you have one, get a prescription, and get the test. In most cases, a physician will give you the prescription because someone in your household has tested positive. In most cases, if you've come into close contact with somebody who has tested positive, close contact is 6 feet for 10 minutes or longer. That's what they designate close contact. The physician will give you that prescription and you can be tested. It is likely a good idea. If you're in a household with somebody who's tested positive, your spouse, your family, child, a family member, it is a good idea. And you are to be quarantined as well because of that close proximity. It is likely a good idea to be tested for peace of mind and also as a means of just ensuring that you're not carrying the virus as well. So yes, good idea to be tested, and that's something that you ought to be encouraged if that is the situation. If you have a question, write it in the the comment section below the live feed. We'll gladly get to as many as we can. I think, though, we've covered most of the important bits of information. Well, this is an important bit. Thank you, Sean. Yesterday, we unveiled a piece of artwork. Nestor, local artist. I'm going to butcher it, so I'm not going to try. Nestor is a local artist, really just remarkable artist. Done some wonderful work here in the community, and he has lent us his The Nurse sculpture. It is on display. It's a temporary installation in the front of the county office building here on Market Street, 22 Market Street. You'll see it is a larger-than-life tribute to the public health, the healthcare workers who have been engaged in responding to this pandemic for these last 11 months. And she represents nurses, regardless, from hospitals and doctors' offices and those in the public health system like Dutchess County, who have been working so hard and sacrificing these last few years. I will say I was a little troubled yesterday. Someone commented on, we had posted this on social media, and a nurse, commented, and she said that they've gone from being, she felt that they've gone from being acknowledged as sort of heroes to, in some cases, ridiculed or vilified, and I think we need to do better. There are people who are struggling with this virus who don't even believe they have it, and these folks in the healthcare world are not part of some grand conspiracy. They're men and women who are likely your mothers and fathers, brothers and sisters, and some of your own children who are off to work every day in our hospital care system, in our public health system, working with doctors' offices who really are sacrificing as they chose to in order to provide for our health, and have been doing just an enormous job, which means, by the way, we need to show our support, and this tribute in the front of our county office building is something really to see, and if you get a chance, take a look at her. We also do have openings within the public health system, where we have the jobs here in county government as part of public health nurses. Public health nurses have always been a part of public health departments. It's not a new thing that we're doing. They have an important role to play. They do tremendous work, and if you're interested in applying or taking advantage of those job opportunities, visit dutchessny.gov/jobs, dutchessny.gov/jobs. I'd also say it's an important time to remind employers, hospitals, doctors' offices, and even us to work to be sure that those in the healthcare system, nurses, doctors, etc., have access to appropriate PPE. This was one of the big challenges early on, a real strain on the distribution and supply chain. This country wasn't prepared to move PPE to communities across the nation. And we just can't make that mistake again, and we need to be sure that those in the healthcare world have access to that protection. Those who are first responders have access to that protection. We've made purchases to be of assistance to the people who work with us. We need everyone to be pulling their weight and making sure that we have access to the protection necessary to allow these amazing people to do their jobs. And believe me, they have felt like there's waves crashing against them, and they've been doing such tremendous work. Sandy, non-COVID question. And some others may be asking it. Fairview, the Fairview Fire District just announced a 21% increase in their taxes. What is their recourse? These are independent governments. These public fire departments do function independently of town, village, and county government. So you should speak to your Board of Commissioners. You should engage in their public hearing process, and you should vote in those processes. I will tell you that our position was very simple. We do not believe that we can shift the cost or the burden of our challenges onto property taxpayers. That is our commitment. Dutchess County government felt that despite the loss of some $15 million in sales tax revenue, despite the fact that we have millions of dollars in new expenses, that we needed to find ways to balance our books without shifting the burden onto property taxpayers. The Dutchess County Legislature, their budget committee just approved our budget, passing it along to the full county legislature. They'll consider that on the 3rd, I think, of December. Our budget does cut spending, approximately $18 million. It does not raise taxes. In fact, there's a modest tax levy reduction, but we do not raise taxes, and we're sustaining services that we provide. And I want to say this very, very importantly. The people who work for county government understand that in 2021, we are going to have to maintain the same, if not expand certain levels of service with less money to do it. Now, there's some people who think that, well, if you cut $1, that means you're cutting the service. I'd say in ordinary years we could have that debate. But this year, 2021, the people who work within this county government have found ways to reduce the cost and maintain service, and most of that is going to be taxing on them. They're going to work harder. They're going to really push it beyond limits that they thought they had. It's not something that can be sustained for multiple years, but it is something they understand is necessary this year because we just have to do it for taxpayers. We have to reduce the cost and the burden, but also maintain the level of service, and our budget does that. I really would encourage every government to think very, very carefully about their expenses, find ways to reduce costs, and try not to pass burden onto property taxpayers. I understand that there are new challenges facing everyone, and I'm not pointing fingers or criticizing, but your recourse as a citizen and as a resident is to bring that concern to the Board of Commissioners and to use your ability to vote in those elections to impact those decisions. But that is a substantial impact that people just can't afford. They just can't afford it. And so those are the options that you have. If you have questions regarding state aid and that sort of perspective, you can also contact your state legislator. But again, the only option you have is to communicate directly with those elected officials, the Board of Commissioners, that do oversee those jurisdictions, those taxing authorities. We'll continue to do our best to not shift the burden and to work with people to drive down costs, but that is a real challenge that I do understand. If you have any additional questions, write them in that comment section below the live feed. We are headed tomorrow into Thanksgiving. I want you to join me in thanking our American Sign Language interpreters. They have been at it with us for several weeks, multiple times a week, and for now many months, once a week, these town hall meetings. And I hope you're as thankful to having them here as we are. We're very grateful for the work that they do. So thank you. Thank you. Did I get that right? Mm-hmm. They deserve applause, that one, I know. But I do want to say this. I know that we live in a time where it is very easy to express our emotion. We can do that on social media. Sometimes we do it in person to one another, which is just as bad. And sometimes we say and think things that perhaps under ordinary circumstances we just wouldn't let out of our mouths. I get it. Believe me, I do. There's a lot of stress, a lot of anxiety, a lot of questions. People have lost trust and faith in institutions, and there are a lot of reasons to not have confidence in the people that you have previously trusted to make decisions to serve us. And we're bombarded by information that makes us wonder what's true and what isn't. That does make life a lot more complicated, and it does make us a lot more anxious. And again, it does make us in many cases, angry. Tomorrow is a uniquely, it's a unique holiday, right? It is that time we are to come together to give thanks for our blessings, for the benefits of our work, for the love of our family. Let us use tomorrow as at least a moment to really take stock of the things that we are grateful for. I'm grateful for my family, for the honor that you've given me to serve as county executive, and for the resilience and the patience that you've shown these last 11 months. There will be families that can't afford to put a meal on the table. They've lost their job, their employer went out of business, the bills have mounted up. We have to find ways to be helpful to them. We are thankful that they are among us, but have to find ways to lessen the burden. There will be families who will come together who won't have that loved one with them because they're isolated in a nursing home or at a hospital, or have lost their life either to COVID or some other health-related issue or some other tragedy these last few months. I know that firsthand, and that is just a burden that no one should have to carry. And there are individuals who will struggle for a number of reasons. We just have to find ways to be kinder to one another, to express our thanks to one another, and to allow that inner love that we know we have for each other to really show outwardly. So please, let's use tomorrow as an opportunity to remind ourselves that we still have many things to be grateful for. We still live in an amazing country that still can accomplish great things, where people, in our darkest of hours, find ways to work together, to find some degree of unity. And yes, there's always a reason to point at someone else and say, yeah, but you should do it first. You should be grateful first. You should show the love first. You should cooperate first. That is easy to understand. But we live in a great nation where if we take that first step, hopefully it leads to others. We live in a beautiful community along this great Hudson Valley with amazing people who've done amazing things these last 11 months, and we're grateful to each of them. So as you settle down tonight and tomorrow, please be safe. Make the decision to keep your events small, to socialize with people that have taken those steps that you have to protect yourself. But no matter what you do, be safe and considerate about your health and the health of others, and find time either in person or virtually to reach out to that person that hasn't heard from you in a while, that you love, that you care for, and that would appreciate knowing that you're thankful for them in your life. And with that, on behalf of the nearly 300,000 people who call Dutchess County home, I wish you a safe and happy Thanksgiving, and wish together that we might stay strong, stay healthy, and be kind to each other.